Thank you very much, and good afternoon or good morning to all of you, and greetings from Derbala from Gaza. Today, I want to raise a few issues. I want to discuss the today released WHO reports on injuries and rehabilitation needs in Gaza. I want to say something about the health functionality, and I want to close with medevac. So first, let's focus on injuries and rehabilitation needs in Gaza. Nearly 42,000 people in the Gaza Strip have life-changing injuries caused by the ongoing conflict, according to the WHO estimates released today in the report estimating trauma rehabilitation needs in Gaza. So that actually you talk about 1 in 4 of these injuries. By the way, 1 in 4 of those injuries are in children. So you talk about more than 10,000 children with life-changing injuries. The life-changing injuries account for 1/4 of all reported injuries, of a total of over 167,300 people injured since October 2023. Over 5,000 people have faced amputation. Other severe injuries, the largest group is actually related to legs and arms, over 22,000, to spinal cord, over 2,000, to the brain, over 1,300, and major burns, more than 3,300, are also widespread. Further increasing the need for specialized surgical and rehabilitation services and deeply affecting patients and their families in Gaza. The report also highlights the prevalence of complex facial and eye injuries, especially amongst patients listed for medical evacuation outside Gaza, supported and managed by WHO. As new injuries mount and health needs rise, the health system teeters on the brink of collapse. Currently, less than 14, I think it's probably 12 or 13, of Gaza's 36 hospitals remain partly functional, while less than 1/3 of the pre-conflict rehabilitation services are operating, with several facing imminent closure. We'll come back to that later. None are fully functional despite the effort of WHO, the emergency medical teams, and other health partners. Gaza once had around 1,300 physiotherapists and 4,000 occupational therapists. Many have been displaced, and at least 42 have been killed from as of September 2024, according to the report. Today, 1 rehabilitation health worker is reportedly killed and 1 injured, along with other health workers in the same attack. Express our condolences to their families. Gaza has only 8 what we call prosthetists to manufacture and fit artificial limbs. Displacement, malnutrition, decrease, and the lack of assisted product mean that the true rehabilitation burden in Gaza is far greater than the figures presented in the report. So you want to stress this is an under-representation. Conflict-related injuries also carry profound mental health toll, as survivors struggle with trauma, loss, and daily survival, where psychosocial service remains scarce. Also, their caregivers, their families, etc., which we often forget. Mental health and psychosocial support must be integrated and scaled up alongside rehabilitation. To ensure to care and the scale of the service, including rehabilitation, there must be an urgent protection of healthcare, unhindered access to fuel and supplies, and a removal of restriction on the entry of essential medical items, including assistive devices. In the long term, of course, WHO calls for ensuring ongoing investments in sustaining and in the future rebuilding a stronger health system, including rehabilitation in Gaza. This includes linking care with mental health, making service inclusive for people with disabilities, training more specialists, and ensuring support from hospitals to community care. Some words on the situation in hospitals, and as we describe it, from wars to hellish. I just spent this afternoon, actually the whole afternoon, in Nasser Medical Complex, and which is the largest hospital currently partly operational in the Gaza Strip, in Khan Yunis. And completely overflowing currently with patients, because we have seen, of course, a vast increase in actually people coming from the north to the south. Estimations is that between 200,000 to 300,000 people are left in the north. So that means that almost 700 to 800,000 people have moved to the south. I met in the Nasser Medical Complex a number of senior health workers from Shifa Medical Complex, which once was the largest referral hospital in Gaza. Only when I was there, let's say 6-7 weeks ago, that hospital still had 600 patients. All trauma patients have been all over the place, and we described that. So they saw an enormous influx again in trauma patients because of the increased hostilities. Currently, Shifa has less than 40 inpatients. More than 90% of their staff have left, and the only 2 functioning units is the dialysis, and you cannot even call it a trauma ward. It's more a trauma service point. So currently 8 hospitals in Gaza City remain partially to minimum functional, serving the vulnerable population. Health services in the north of Gaza governed are only provided through one particularly functioning medical point. At least 44 health service points went out of services between 11 and 28 of September. This includes Trontisi Pediatric Hospital, St. John's Eye Hospital, the Ministry of Health, Ophthalmic Hospital in Gaza City, and Hamad Rehabilitation Hospital, one of the few rehabilitation hospitals, all in North Gaza. In addition, 13 primary healthcare centers and 27 medical points. I already raised Shifa Medical Complex, but also when you talk about Al Ahli, which is currently minimum functional. And we now already get requests to, for example, a medevac, the last patients, the remaining patients in Ilu hospital. Actually, those are neonates, but also today we were also requested, very soon we will get the same, what we have done in the past as well, taking out the last patients and maybe some of the supplies. A total of 136 dialysis patients, representing around 50% of the estimated dialysis population of Gaza City have been displaced out of the city. Of these, 61% are currently receiving care at the hemodialysis unit of Al Zawaida Field Hospital, where the caseload has increased by 150%. An additional 20% have been referred for hemodialysis in Al Aqsa Hospital. We see fast declining shortages for essential items such as dressing kits, particularly gauze, but also essential post-operative wound care materials, critically impacting the ability for trauma cases, and specifically everything around blood supplies, and including the whole blood component, blood bags, etc., transfusion sets, etc. WHO has procured that, and we struggle to get it in currently, because a lot of the entries are actually closed. On Nasser, I just already said, neonatal unit functioning under catastrophic conditions. Facility was designed to accommodate 17 infants, but is carrying for 26 newborns, sometimes sharing 2 or 3 newborns in one incubator. Let me say the last few words on medical evacuation. So with the increasing violence, particularly as the incursion in Gaza City intensifies, medical evacuation remains a flagship WHO program. Just last Monday, we actually medevaced 180 patients and companions. Gaza health system is unable to provide specialist care of services beyond the most basic emergency treatment. 15,600 people, including 3,800 children, need to be medevaced. Since October 23, WHO supported the medevac of 7,841 patients, including 5,405 children. With the conditions worsening, what we actually are requesting consistently, and I think we get a bit more traction on this request. First, that we need many more countries to accept patients. Second, equally important, maybe even more important, is the restoration of the West Bank and East Jerusalem medical referral pathway. Over to you.
much. I'll now turn the floor over for questions. Yes, please. Gabriel.